Hello everyone. So in this video we talk about acanthosis and how do we manage it. Recently we had a talk show with an endocrinologist, Dr. Jayashree from Chennai, and this video are the take home points from that conversation for people who have missed it. So Acanthosis nigricans is basically a skin condition in which you get thickening and darkening and velvety appearance along with skin tags on very specific areas like the back of the neck, side of the neck, underarms. It could be on your your knuckles, it could be on your elbows, and very specific deep pigmentation on the forehead, on the side of the faces. Now acanthosis can be because of many reasons, like we discussed the other day. It could be genetic, it could be because of sedentary lifestyle, overeating, it could be because of obesity, and it could be because of hormonal changes as well happening. Example, like the commonest is the PCOD, and sometimes because of a cancer happening in the GI tract. Now today in this video we talk about, once you have acanthosis, how do we manage it. Now acanthosis, like I said, is a condition wherein insulin resistance is high. So you have a lot of free flowing insulin which is not getting utilized in the body because of the obesity and sedentary lifestyle. Your muscle and fat are not absorbing the insulin, so you have an insulin resistance. So in this case we have to first do your BMI. So your BMI should be less than 25. It's nothing but a ratio of weight is to height meter square. That's the ratio. The simplest another test is, what you can do is take your abdominal girth with an inch tape, and if for females it's about 35 inches. If you're beyond that, then it's little dicey. For males it is about 40 inches. Now when we go about and we find out what is the reason behind the Acanthosis nigricans, that's the insulin resistance, we run through a lot of blood tests like blood sugar levels, fasting insulin levels, lipid profile, and your uric acid. These are the main ones which we actually need to do it to find out whether really are you insulin resistant. The treatment goes as to lifestyle. Now lifestyle, first is exercise. Now exercise, because the more movement of the muscles you do, the more faster the insulin will get absorbed. So your exercise can be in the form of dancing, it can be in the form of swimming, even in if you have a and you have to do it the entire day. So it's not that 45 minutes you go to a gym in the morning and you come to the office and sit like how I'm doing, actually wrongly. But you have to keep moving around your desk, if it's your clinic or if it's your workplace, keep moving so that the more the muscles, so you can do a weight training, you can do an exercise, you can do an aerobics where the muscles are getting used. Even when you're doing a yoga, try to hold it upon for a longer pose so that the muscle, the strength of the muscles will absorb the extra insulin, and that's how the insulin levels will fall down. So this is about exercise. Generally 45 minutes in an Indian standard for about 5 to 6 days is quite adequate, but if you are actually overweight, then you can do it for some time more. But 45 minutes per day for about 5 to 6 days a week is very essential. This is about exercise. Second comes diet. Now no sugar, high fibers, moderate protein, and average fats is what is needed. So the actually the food stuff which causes the maximum amount of insulin secretion from the body is the carbohydrates. So refined sugars, white bread, white rice, and your junk stuff, aerated drinks, these are the ones which have tendency to cause excess insulin secretion. So you just stop all of those and go on to complex carbohydrates like wheat, chapatis. In fact, they also lead to insulin secretion, which you can taper it down and use other cereals and other pulses to complete your food. But still, if you cannot, then you can go down on the chapati levels also, and you can go down on the complex carbohydrates. Second is fats. Good fats are essential. You can take them like ghee. Then proteins, you need good source of protein so that the protein levels can be made up, and your insulin is actually not much secreted when the protein is intaken in the diet. And definitely lot of fibers. So fibers in the form of vegetables, fruits, all of them in ample quantity will be needed. Now whatever kind of fancy diet you feel that is able to lose your weight, you can do an intermittent fasting. Actually, to tell you, many of the experts say that it's only 2 meals per day is enough. In between junking and snacking, if you are overweight or obese, should not be done, and that is adequate, because the pancreas really needs a rest to secrete insulin. It needs a break. But if you keep on munching, if you keep on taking, okay, 5 o'clock snack, 7 o'clock snack, then the body keeps secreting insulin to digest that food. That is why give intermittent fasting, so that the pancreas it takes a break and the insulin secretion is low. This is about food. Have ample of water, that's also very important. Next is a little bit of reduction in the stress. So we've seen many people who have this kind are also quite elevated in the stress level. So you have to introduce some kind of meditation, some kind of reading, some kind of a relaxation time for yourself during the day. And sleep. So regularize your sleep habits. Though they say artificial lights even at night will cause insulin secretion, because the body feels, okay, it's time to wake up, so it'll boost your muscles, your fat, your energy, and your brain. So it'll secrete the insulin. And in that case, when you're actually sleeping at night, make sure the gadgets are off, and make sure that the lights are also put off completely. There shouldn't be any source of light coming from your any small tube light or any other. Make sure that it's completely dark and when you sleep. And do wake up when a bright light is on. That is where the body starts functioning back again. So these small tips, I hope, are good enough for you. And of course, the medical part of it, dermatologist, a gynecologist, and an endocrinologist hand in hand will take care of you, either with metformin, or we have alpha lipoic acid medications which are available. Also, if you have PCOD, then it's a different workup with the gynecologist, with OCPs, progesterones, getting your menstrual cycles into place, and your acne coming into control. So with all this, the medications, what do we look at? Acanthosis takes about at least 3 months to show a reduction, and it may take as maximum as about, say, maybe a year or 3 years. Of course, your lifestyle is the major, then the medications, and that's where acanthosis comes under control. And that's how other factors and other parameters like your insulin levels, sugar levels, and cholesterol also will come under control, and you will sustain this healthy state of life. Now, another thing is, what do we actually get worried when we have acanthosis? Now, we have clients coming from 10 years to about 60 years having acanthosis because of many reasons. The basic treatment what a dermatologist offers you are creams which will help to reduce and kind of normalize the excessive thickness which you have on the neck and on the other places. So you have actually dark patches and pigmentation everywhere. So these creams will help to normalize it, thin it down, flatten it down. And there's some good deep peels which are available, like glycolic acid. You have trichloroacetic acid, which actually will help to reduce the thickness of the skin, and that will help the client to feel better. So there is also a factor of feel good, that yes, the pigmentation is getting better, the skin is feeling better now. We have to do multiple sessions, about 5 to 6 sessions, for the skin to get normalized. And it's a long process, but finally it is dermatologist and the medications which we are doing for the insulin resistance hand in hand will take the acanthosis completely away, but which will take time. So we'll handhold you till the end of the treatment, till the end of how you come back metabolically into a normal parameter of the levels of sugar and insulin. Meanwhile, please follow the lifestyle changes, the diet, the exercise, the medication, sleep, and your stress levels, and the medications will also work. And along with that, the dermatologist will put in efforts to reduce the pigmentation. So this is all about acanthosis. Did you see that skin is not only skin deep, but it is much deeper inside the body also. So try to get in touch with us as soon as possible, because help is available. Do not shy away or get discouraged that there is no other help available in the society. Acanthosis is pretty common. Like I mentioned, 10-year-old also can present with acanthosis, and a 60-year-old also can present with acanthosis. So if any other queries, you can DM back to us and we'll be will be really happy to help your case out. And if anybody in the vicinity has acanthosis, please mention that, approach a doctor, and it's just not dirt or any kind of a friction. Thank you so much.